When I was a young lad, just a little chamaquito, I remember this time when I was talking to my beautiful abuelita while she was taking her medications, and I remember that she would keep them in this cute little container that had several little compartments, one for a different day of the week. And I asked her what they were for. Young Miguelito, always being curious, you see. And I remember that my abuelita just laughed and said, "No sé, mijo, I just take them." And by now, we have all gone through a full year of clinical rotations, and I am sure that a few of you have experienced talking to a patient who maybe wasn't taking their medications for some reason. They may not know what medications they are taking, how to take them, nor why they are taking them in the first place. And because our time is very limited with each patient, we really don't have the time to go over it with them in detail. And in the meantime, the patient is left lost, confused, discombobulated about their medication situation, and this can lead to more health issues. With that being said, my group and I are working and building on the idea from the class before us, and we planned on creating a medication passport that is customized to each patient based on their preferred type of medium, whether that is electronic, audio, or handwritten, the goal being to improve patient medication adherence. So the target population we are targeting are patients who are not compliant with their medications due to poor health literacy. And after diving into the literature, we see that the national data shows that more than one third of US adults have limited health literacy, which contributes to poor health outcomes and affect patient safety and healthcare access and equality. In a study by Joanne, findings suggested that health literacy affects decision making preferences in medically underserved patients. The research showed that individuals with limited health literacy are more likely to be hospitalized and make medication errors and less likely to obtain preventative care and know how to manage their health problems. This study showed that patients with adequate health literacy were almost two times more likely than those with limited to prefer patient involved decision making. The patients with limited health literacy may have difficulty understanding medical information and lack the self-efficacy to be actively involved in their care. And in the McQuaid study, it showed that adherence to medications is dependent upon a variety of factors, including individual characteristics, the patient's family, and their culture. Because this is associated with worse outcomes, poor medication adherence is considered a potential contributor to disparities in health outcomes. Medication adherence rates were also a lot lower in patients with lower SES. Adherence is ultimately influenced by a variety of factors that are important for healthcare providers to consider. Ineffective patterns of communication and lack of healthcare provider understanding how cultural context influences the patient's beliefs may impede adherence among patients from diverse racial and ethnic backgrounds.
To make sure our project was meaningful and rooted in real world needs, we began by looking at data from multiple sources, regional demographics, clinical level needs, and national health priorities. Originally, our focus was on SPA4, which is the metropolitan area of Los Angeles County. This region has a population that is about 50% Latino, and one third of the residents speak Spanish at home. We know from public health data that language barriers in this area are linked to low medication adherence. So, our goal was to address that directly through culturally and linguistically tailored education. However, as the semester progressed, our placement shifted to the La Palma region in Orange County. While the location changed, the patient population remained similar in terms of language needs and health disparities, so the intervention remained just as relevant. From our needs assessment, we discovered that many patients did not fully understand why, how, or when to take their medications, and they often preferred non-written tools like visuals, audio aids, or simple verbal explanations over just printed materials. This reinforced our decision to create a personalized uh, medication passport that could be adapted to meet each patient's preferences. Through asset mapping, we identify the strengths that are already available to us. So we had a multilingual team. We're all fluent in English, some of us in Spanish, and some of us in Chinese as well. We had EMR access to double check our medication accuracy, and we had strong support from PA Caleb, who helped us build our workflow into the clinic setting without disrupting patient care. Finally, we made our project aligned with several Healthy People 2030 objectives, including ensuring providers clearly explain information to patients with limited English proficiency, improving health literacy at the national level, and encouraging providers to confirm patient understanding. These goals really reinforce our focus on clear communication, patient involvement, and health equity. Everything we did was rooted in health literacy. We used a 5th to 6th grade reading level, offered visual and audio tools, and always communicating the patient's preferred language. We embraced cultural humility. We asked, we listened, and we never assumed. We met patients where they were and recreated a space that valued their voice. We used trauma-informed care principles, always asked permission, sat at eye level, and explained each step. This really helped build trust and empower the patients to speak up if they had any concerns or questions. And our approach to equity and inclusion was simple. If a patient wanted to participate, we welcomed them regardless of language, background, gender, or belief. Now let's take a look at the 4 main objectives we set for our intervention. These were carefully designed to be clear, measurable, and directly tied to our patient outcomes. So objective 1, highlighted in green, report having confidence with taking their medication as prescribed. This was assessed both in the pre and post surveys where patients self-reported how confident they felt managing their medications. This goal was to build self-efficacy, especially in patients who may have struggled with adherence in the past. And then objective 2 in purple, accurately demonstrate how and when to take each medication. This went beyond just the survey responses. We asked patients to walk us through their daily regimen. For example, they take the medication by mouth each morning before eating breakfast. This just gave us real insight into whether the patient truly understood the regimen. And then objective 3 in blue, report knowing what condition each medication prescribed is treating. So we wanted to move away from just take this towards more truly understanding what they're taking the medication for. So we listened for responses like metformin is for my diabetes and lisinopril is for my blood pressure. And then objective 4 in yellow, we wanted to report an increased understanding of how their medication is helping them. This one was a little bit more advanced for certain patients, especially those who may be overwhelmed with kind of the medical jargon or those who may have a limited health literacy. But we generally just ask, what does this medication actually do for you? And a good response would have been, it helps my body better absorb sugar, which therefore protects my organs. In summary, these objectives helped us ensure that intervention wasn't just informative, it was really empowering. We wanted patients to leave with knowledge, confidence, and clarity. Now that we reviewed the objectives of our intervention, here's how we evaluated whether we achieved them. This slide shows the pre and post surveys that we used with every patient. They were administered verbally in the patient's preferred language and with assistance provided that they needed any. And here we also highlighted a few of the questions in the survey to show how they directly correlated to our previously stated objectives. And this slide outlines the 4 main phases of our intervention, showing kind of the flow from check-in to check-out. So step 1, the patient's roomed, and as soon as the patient was roomed, we introduced ourselves, and if the patient was willing, we administered the pre-survey. We offered help as needed, especially for patients with any literacy or language barriers. The goal here was just to assess baseline knowledge, confidence, and preferences related to their medication passport. Then step 2, the clinician would see the patient. While the provider conducted the clinical visit, we reviewed the patient's survey responses. We used this time to decide which format of medication passport would best suit the patient, whether that was written, visual, or audio based, based on their learning preference on the pre-survey. And then step 3, which is our actual intervention. So this is after the provider concluded their visit. We return and deliver their personalized medication passport. We walked the patient through each medication and its purpose, and then asked them to walk us through a typical medication day. What to take, when to take it, and why. They were encouraged to use the passport as a reference during this exercise. And then step 4, patient checkout. So before leaving, patient was to complete the survey, again with assistance if needed. And this really, post-survey, helped us assess how much they had gained from the intervention in terms of knowledge, confidence, and comprehension. This structured approach ensured that each patient received individualized attention and left the clinic with a stronger grasp of their medication regimen.
For the survey results, 9 patients filled out the pre-surveys and the post-surveys, where there's an 89% increase in medication literacy. 7 of the 9 patients preferred pen and paper, where 1 of the 9 patients preferred technology. The 3 aspects that we felt like there was a growth in: 1 was the translation services, 2 was the written summaries, and 3 were the utilization of technology. With the translation services, this did lead to an increase in comprehension. Patients did feel more confident following directions when the materials were spoken in their native tongue. And also, there's this cultural relevance and tone that also played a big role in how the information was received. This was particularly most relevant for those that were mainly Mandarin Chinese-speaking patients. For the written summaries, this reduced patient confusion and just increased overall recall with the patients. Just writing it out in plain language summaries really did help bridge the literacy gaps, even with native speaking English speakers. And patients preferred one word or short bullet points over long drawn out explanations. And the long drawn out explanations were done in person, but on the actual pen and paper or the phone, it was all just one word or a little phrase. And the utilization of technology. The digital formats did allow for a real-time update to the medication lists. We were able to, instead of crossing things out or circling things or scribbling things out, it was really easy to just erase things and just type it in a matter of seconds. And so this really bridged the gap between the providers and the patients, making the information just a lot more interactive and especially portable. And so overall, all the patients did feel like they had more control of their medication. They reported more confidence in taking control of their health and just an increased literacy with what their medication is actually for. For the intervention impact and the discussion, the intervention impact, we focused on how there was an improved medication comprehension, there was increased medication adherence, there was enhanced accessibility, a higher patient satisfaction, and a successful technology integration. Patients were able to demonstrate just a better understanding of their medication names, dosages, the purposes, and there was a decrease in misunderstanding. Some patients did initially understand what medications they were taking. They knew the dosages and even the names, but they didn't know what it was for. And all the patients didn't know exactly what their medication was for, so this really helped clear things up for them. Even just writing down a quick heart next to their medication, or a quick sugar level, or headache. Patients felt a lot more comfortable afterwards after these misunderstandings were cleared up. Patients reported feeling more likely to take their medication after knowing all this information. the increased accessibility. Although we didn't have any patients specifically that we had to incorporate braille or pictures or sound, there's no doubt that with an increased length of time for this study, or doing it over more patients, other forms of increasing accessibility besides pen and paper and technology will be utilized. And kind of like I mentioned in the last slide, 89% of patients felt more informed, they felt more involved, they felt a lot more confident in their treatment plans. And part of this was with the integration of technology. Even though it's just one patient, this patient population is typically a little bit older. And so they did seem to prefer pen and paper compared to those that would be a little bit younger, where a phone is a lot more accessible. It's something that they grew up with, they're more familiar with. And so as the younger population does get older, I can see this becoming even more crucial and impactful to their health. And so overall, this does show just how important something like this is in order to make healthcare a lot more inclusive between the provider and the patient. And it does this especially by just bridging the gap between certain language limitations, as was present most commonly in the surveys that I conducted, as well as health literacy, with all the patients not entirely understanding what their medications were for, or even some not even knowing what medications they were taking.
Now that you've gotten an overview of our project, I'm going to get into the obstacles, solutions, slash star wish section. So a big obstacle that we faced during this project was our clinical site not working through. Initially, we were set to do our project at this one specific clinical site. We had contacted the medical director. The director gave us the okay. Just last minute it wasn't able to work out. This was very unfortunate because most of our research was targeted towards working with this specific patient demographic. Thankfully, Paul was able to transition us into being able to do our intervention at Joshua Medical Center. However, they just had other obstacles that we had to overcome. However, I do think we achieved a few stars, including being flexible and working with what we had very last minute. Another one would include adapting our project and learning what we could about this new patient demographic to ensure that our project was targeted towards this patient demographic. And then lastly, this leads me to the wish, just wishing that we had more time to follow up with these patients to see more of the long-term implications of our project. In terms of sustainability, it is unfortunately going to be hard for this project to continue once we leave. We are leaving our information here in case any future students do wish to pick up from where we're leaving off. A potential area of interest might include having PA students collaborate with pharmacy students to see how both students could work together to better help patients. Another sustainable aspect about our project just includes helping patients be better advocates for themselves. We're hoping by teaching patients about their health and their education that they know what questions to ask their providers to have them be more in charge of their health. And besides that, just acknowledging our own limits as well. We're not always going to have time to dedicate this much time to teaching patients about their medication. So just letting them know about other resources, telling them, hey, if at any point you do walk out without fully understanding your medications, please know that the pharmacist is there to help you. So ask them any questions that I might not be able to answer.